how to treat reflux and other digestive complaints. And our speaker today is Sally Rappeport. I'm very excited to have this topic and have Sally teaching us because I love this style of learning Chinese herbs and formulas and to deepen my knowledge. It was a painful experience for me in school, how I had to memorize everything. And then when I discovered Sharon Weisenbaum's teaching and all the people that studied with her, including Sally, I now love to learn about herbal formulae because they bring it into such a practical way, an enjoyable way. So if this is your first time with Sally, you're in for a great treat on how to learn and understand formulas the way I think they really were meant to understand and be received. Sally also runs the Shandong Society and she puts on a conference annually. So she's really focused on bringing classical Chinese herbal medicine to us. And I thank her for that. I'm grateful for that. And I'm very appreciative that she shows healthy seminars to teach this lecture. I just want to do a quick reminder, our disclaimer, that this lecture is for educational purposes only. This is not intended to be medical advice. Therefore, it should not be perceived as medical advice. This is for educational purposes only. If you have a health condition, please do seek out a qualified healthcare provider because this is for educational purposes. All right, can we please bring up Sally's PowerPoint, and we'll give her a moment once that PowerPoint is up to start to get control of it, and then she'll start teaching. You guys be ready, be attentive. Sally's going to ask us some questions as well to make it a little bit interactive during the live webinar component. If you're watching this as recording, when she asks the question, pause, think about it, and participate as best as you can as well. All right, Sally, we're all ears.
Okay, I'm working on the controlling. So let's see, that's not quite. Oh, I have to do it.
Center?
I clicked in the center.
That's okay. So from here, you see up in the top left-hand corner, there's a from beginning. Just click on that.
From beginning. Okay, yeah.
There we go. Perfect.
Okay. Welcome, everyone. I'm just going to check and make sure I have control. Yes. So I see some familiar faces in the participants and some new faces. So I really appreciate that. I am excited about teaching this class. Thank you so much, Lauren and Sandro and Lorianne, for supporting me in doing this. And I am really excited. So let's get started. Bummer in the belly, how to treat reflux and other digestive complaints. And we will be talking about some conditions that are not digestion because of the nature of the Shishin Tang family of formulas, which we're focusing on today. So First, I'm going to tell you a little bit about my background for those of you who are new to me, and then a general introduction to the concept of Glomus, which is essential to understanding this family of formulas, and an introduction to digestive physiology through the format of the 6 conformations. And for those of you who are primarily have studied a TCM perspective, this will be really new. And it does take a while to grasp, but it brings so much depth to your ability to diagnose and understanding of our medicine. So we're going to focus on Banxia Shintang in detail. Little typo in there, sorry. Banxia Shishintang cases. Then that's when we'll have a break, and then we'll look at some other formulas and cases after that. So first, I always like to give a thank you and acknowledgement to my teachers. I did want to say, for those of you who are watching the live presentation, I've added a couple of slides, and those have asterisks on them, and you will get a copy of this through Healthy Seminars. Yaron Seidman, once I started delving into the classics, into studying the Shang Yaron was a huge influence. He's from the Fire Spirit School and has an amazing understanding of the classics. So that was really instrumental to my understanding and use of those texts. And it was somewhat the beginning of me. I mean, actually, right before that, I had already started sitting down at my kitchen table with lots of translations of the Shanghanlun in front of me, and just trying to really deeply comprehend these formulas. And that was probably 15 to 20 years ago, and I just keep going. It's a lifelong pursuit and brings a lot of joy to my life and help to my patients. I studied with Dr. Feng Shulun at the same time that I started studying with Sharon Weizenbaum. And Dr. Feng Shulun has a particular perspective that's through the parameter, it kind of leaves out the Huangdi Neijing and really focuses on the 8 parameters. And it has its own clarity, but I feel like it also misses the Neijing, which is just so deeply important to our medicine. And, but it's all helpful. It's all helpful, and you can certainly get lots from studying from lots of different perspectives. So then I went and studied with Ed Neal, who translates the Neijing. He's exclusively focused on the Neijing. He did a wonderful talk about COVID on Healthy Seminars that if you haven't listened to, you should. And just has a very special perspective and translations that just gives you a much deeper understanding of the Neijing. And then a few years ago, I had the opportunity to start learning Chinese medical translation, which I wish I would have started doing 20 years ago, but I am so glad I've delved into it, and I am still a gross beginner, but Craig Mitchell was a wonderful teacher, and he doesn't teach translation very often, but if you ever have the opportunity, I highly recommend it. And then, of course, my main teacher has been Sharon Weizenbaum, who just has this incredibly lovely, articulate grasp of our medicine. And she's been a huge influence and lovely friend, and I really appreciate her very much. Okay. So let's begin by looking into Glomus. The Chinese word, and pardon my tones, is P for Glomus. So it's a common translation for Glomus is focal distension. In Wiseman, a practical dictionary of Chinese medicine, this is how it's described: a localized subjective feeling of fullness and blockage. In the chest, it can be associated with a feeling of oppression in severe cases. Hence the terms fullness in the chest, distension in the chest, glomus in the chest, and oppression in the chest are largely synonymous. In the abdomen, which is what we're going to be focusing on today, glomus is the sensation of a lump that cannot be detected by palpation. Hard glomus below the heart, which can be subjectively felt and objectively palpated, is a sign of evil heat with water collecting in the stomach. Any palpable abdominal mass is referred to as glomus lump, although in texts predating the Shanghanlun, they are referred to as glomus. Lump glomus in traditional literature are labeled differently according to their shape, behavior, and pathomechanism. The character P is made up of the illness signifier plus the character P, which when pronounced P means blocked. So if you pronounce it differently, use a different tone, it would mean something else. So interestingly, in one of the pre-Shang dictionaries, this character means pain. And it's also translated as a ball-shaped mass. So I think of it as being a fullness that involves a blockage that is not that is usually not palpable unless it's a hard glomus, but mostly it's a subjective feeling. I also think it's interesting that one of the hexagrams in the I Ching is called P, and its translation varies, but it's often the translation means stagnation. And if you look at this hexagram, what you see is the 3 yang lines above and the 3 yin lines below. So that's a reversal of what it should be. The yang should be below, supporting the yin above. So this hexagram, the yin and the yang are separating. The heat is going up and the yin, the damp, is sinking below. So that is very significant to exactly how this P syndrome expresses, that Glomus expresses in the body. All right, so since Glomus is primarily a subjective sensation, how do we confirm it with our patients? Well, for sure, this is different if you're practicing live with your patients or if you're using telehealth. When you have a live patient, what I do is kind of stretch the skin with my hand here and feel, actually that's a little bit different. For Glomus, that comes later, the stretching the skin. We'll talk about that later. With live patients, what I do is just use like 2 fingers and poke around, right around this epigastric area. So, you know, not too hard because they could be super uncomfortable there, but a little bit. So, and firmly. And you need to watch their face, of course, while you're doing that. And sometimes, you know, it varies from person to person, but often they will grimace if they have a glomus. I also will ask, does that feel just a little weird or a little uncomfortable or a little icky? Or is it really icky? Is it really uncomfortable? So it's not that complicated, and it really works to do that. And if I'm doing telehealth, I actually will move my camera down so they can see my epigastric area. I don't see myself right now, so I can't do it for you, but I will show them how to do that to themselves. And that works pretty well. I have definitely found patients with Glomus during telemedicine in that manner. So you ask them to take 2 fingers on each hand and just press right under the sternal notch in that epigastric region. And sometimes the patients will say, ooh, yeah, that feels terrible. And then you know for sure that they have a glomus. It is a little bit difficult if they don't say, oh, I feel really uncomfortable right under my sternum or right below right in that, like they point to, their hand goes right to their epigastric area. It can be difficult if you don't actually ask them to poke themselves. Okay, so why is understanding glomus so important clinically? Many patients have glomus, although it is not always their chief complaint. They may be coming to you for insomnia, for acne problems, for something other than digestive issues. But as you're going through the 10 questions, you realize that they also have indigestion or reflux or some other issue that makes you wonder if they have a glomus. And so I almost always on an initial visit will do abdominal palpation, but if that's not part of your practice, through your questioning, you need to figure out if it's something you should check for. So sometimes I might only discover it when I'm doing the abdominal palpation. But most of the time I'm questioning, I'm kind of wondering if that might be the case, and I will direct my questions into some of the symptoms of glomus to find out if they're experiencing any of those, and we'll get to those in a minute. Many other patients have some reflux, but that also isn't their chief complaint. So yes, reflux is one of the examples of things for sure that might come up in your intake that will clue you in that glomus is something that you should check for. If you don't address checking for glomus, their chief complaint may not respond to treatment, and you might be treating them for insomnia and they're not getting better, and you don't understand why. Why aren't they sleeping? I've been giving them Guipi Tang. I've tried Guijia Longumuli Tang. I've been giving them these herbs that should help, but they're not feeling better. Why? And that is also a key. What else should I look at? So many different glomus patterns treat the digestive disturbance caused by glomus, as well as various other signs and symptoms that accompanying it. So we will look at some of these various signs and symptoms today. By differentiating the glomus formulas carefully, you will be more effective in treating many different cases. Sometimes acid reflux